And good morning. It is 20 minutes after 7 o'clock, and joining us in studio this morning from Lovelace Regional Hospital, Dr. Peter Jewell back with us. Morning, doctor.
How you doing?
Doing great. How about yourself? How's the fall treating you in your office here?
Pretty good. It's getting busier.
Yeah.
So, the last time I saw you, I was seeing probably, I don't know, tops 8 patients a day. Now I'm back up to 15, 16, heading for 20. Probably that's what they want me to be at.
Okay.
So, it's getting busier. What happened when I saw you last time, it was all the credentialing, insurance, you know how that goes.
Sure.
When you first started a new office, it takes forever to get all of the insurances on board with you.
Sure. The red tapes and everything else.
Oh,
And
no idea.
Well, and that's the thing. It's funny. It's like, even though these people have already insured you, before.
Yeah.
Now,
yeah,
I guess, I don't know. There's other red tape they got to look at to see if that red tape jives with that red tape. I don't know.
Insurance companies wanting to make a lot of money. I think that's what it is.
I would not disagree with you one little bit here. But, of course, for folks that aren't familiar, Dr. Jewell's a family practice, basically jack of all trades doctor. You gotta, if you have something wrong with you, he's the first line of defense for you on that kind of stuff. And obviously with family medicine, a lot of it can be done right there in your office.
Yes, sir.
But if it's something more serious, then you need to see a specialist. Of course, Dr. Jewell will make sure you get to those officials and things. So.
One of my philosophies when it comes to referring to people is I try very hard to send my patients to somebody that I would see myself.
Gotcha.
If I didn't feel comfortable seeing that doctor, or if I didn't think that my family, if I didn't want my family to see them, why would I send my patients to them?
Sure.
A lot of my patients become almost similar to family when I've seen them, because most of my patients have been with me at least 10 years.
And I got to figure, as a doctor, especially a family practice doctor, it's by default just part of the job, because you come in and you see families, a couple times a year, depending on, how big the family is and how often things happen. But generally, a couple times a year, you're seeing the family, and you kind of, and obviously, when you're dealing with folks' medical history, you're getting a little intimate there. So you find out things about families, and you learn that they go to your church, or they go to your soccer games, or whatever you're into, and that's kind of life. But you just by default, you kind of learn more about your clientele and things, because it's a more intimate relationship.
Absolutely.
Yeah. So that's a good thing.
You're correct. 100% correct.
Of course, this month, for folks that aren't aware, is Diabetics Awareness Month. We're raising awareness for diabetes. I ain't gonna lie. In my lifetime here, and I'm yours as well here. When we were kids, this was something a very few people had or talked about, and now, more often than not, over 50% of the population has it. You know what I mean? It's one of these things, and it's like, well, what happened here? And there's probably a lot of variables in this here, but the thing is, this is something that every American, I don't care if you're a child or 78 or 80 or 50, somewhere in between. This is impacting everybody at every phase of life right now.
I myself am a type 1 diabetic.
Yeah.
So yeah. I guess I'd start out. Let's differentiate the two different types of diabetes, because I get this question every single day in the office. Type 1 diabetes, typically, not 100%, typically occurs younger in life. Again, there's all kinds of variables with that, but typically starts younger in life. I found out that I was a diabetic at the age of 11.
Okay.
And it was crazy because my parents had taken me to see Star Wars, had to wait in line. The original Star Wars, the first movie that came out.
A New Hope.
Yeah, exactly. And every 5 minutes I had to go to the bathroom. That is the most common symptom in type 1 or type 2 diabetes.
Okay.
If you're having to urinate a lot, you're thirsty all the time.
Is that your body trying to get the sugar out, in essence?
Yes,
Okay.
because essentially you don't start passing glucose in your urine until your sugar's around 200-ish.
Okay.
Again, there's variables with that. But, if you don't know you're a diabetic, which they estimate about 15 to 20% of the population of New Mexico is diabetic, don't know that they are.
Yeah.
But if you don't know that you are, you just go about your regular daily habits of eating anything,
Sure.
and of course, here I am as a kid at Star Wars. What am I eating? Starburst. I'm shoving them into my mouth and,
Sure.
and popcorn. I didn't know any better. I didn't know I was a diabetic. but my parents thought, yeah, there's something wrong. You can't sit still for 5 minutes to watch this great, more or less it became more than a kid's movie, but at that time, that's kind of what it was.
Sure.
And I couldn't sit still for 5 minutes. I'm going to the bathroom, going to the bathroom, going to the bathroom. And my parents at first thought that was a kidney issue because they didn't know any better.
Sure.
And then I go to the doctor and sure enough, diabetes.
Okay.
So, that I wouldn't say that that's what I see every patient with, but almost every patient, that's one of the symptoms that they have.
Gotcha.
They're constantly thirsty. They got to pee all the time. They're losing weight, vision issues, all of these things, confusion, fatigue, all of these things can be signs and symptoms of diabetes.
Gotcha. Okay.
So type 1 diabetes usually occurs early in age. And the researchers are now saying that what they believe this is at some time during youth, they got infected with either a bacterial agent or a virus, and our antibodies start attacking a certain part of your pancreas.
Okay.
The islets of Langerhans, beta cells, right? And that shuts off that part of the pancreas. You no longer make insulin. They used to term type 1 diabetics as insulin dependent. And that's more or less kind of the real defining factor.
Gotcha. They don't make insulin. You got to make it for them.
Right.
Gotcha.
So there's less type 1 diabetics out there. Type 2 is what we're seeing, not a pandemic of, but an epidemic in the United States of America. And type 2 diabetics, there's multiple reasons why this happens. Your cells can become resistant to insulin. Insulin's required to carry glucose into your cells. Every one of your cells, from your hair cells to your heart cells, requires sugar, glucose. It's kind of like gasoline in a car.
Mm-hmm.
And in order for you to get that glucose into your cells, that insulin has to do its work by carrying it through the cell walls, right?
Gotcha.
And you become resistant to it, almost like I'm going to use a drug addict, right? He needs more to get him high or keep him level, I guess. That's the only way to describe it. And you become resistant to this insulin. You need more and more and more and more and more. Sometimes type 2 diabetics get to the point where they need to start taking insulin for the very same reason, because it overloads their system.
Gotcha.
Some of the reasons why type 2 has become an epidemic, I would say our diets.
Mm-hmm.
We eat a lot of processed foods, lack of exercise. I mean, let's face it. When I was a kid, almost everybody I grew up with worked in the construction fields. Now people are computers and more sedentary lifestyle.
Sure.
Now, there are some exceptions here in Roswell. We're a big oil producing part of the country. So, yeah, there are a lot of oil workers. But then when they get older, what do? They go into management, right? And not as active.
Sure.
That can lead to it too. So that's why I think we're seeing a huge increase. And what do you see on every corner?
Yeah.
Fast food.
But I would make this point too, and now, granted, you're a doctor. I'm a dumb DJ, but
That's not true. That's not true.
But we look. I would also argue it's technology in food. You look at growing up. There wasn't. In the 50s, there wasn't a frozen food aisle with every single thing. You wanted to cook from scratch, or the 50s, they just really started doing like condensed milk and things that were the shortcut version of stuff. But to make these products, there's a lot of things they need to preserve it, to create a shelf life, to make it look, additives, whatever. And I got a feeling none of that stuff is bad for us. And I gotta admit, I gotta think some of that is contributing to see these numbers as well. People just think, hey, I'm eating a bowl of carrots or whatever it is, and that's not really what you're eating there. You're eating this processed everything else. And so I think there's really some of that, people thinking they're eating healthy and they're really not.
Here's the key. If you want to prevent diabetes in yourself or your family, read the labeling. See how many grams of carbohydrates are involved with what you're eating and how big the serving size is. I have patients, when we're talking about borderline diabetes, which is also rampant, I tell them, try to keep your meals anywhere between 45 to 50 grams of carbs per meal.
Gotcha.
That's easier said than done, because if you think about it, your average slice of bread, average means, there's some that are way higher, some that are less. one slice of bread, 25 grams of carbs. So if you think about it, you eat a sandwich, that's it.
That's you're done.
No fries, no potato chips. And what I'll tell patients, same scenario, I'll say, okay, you go to a fast food restaurant or to a nice restaurant and you order a burger that has a bun, obviously, and you want to eat fries. Okay, perfect. But you probably want to drink water or a diet soda, not a regular Coke. Because if you drink a Coke on top of that, you're looking at your carbs being fulfilled for the entire day.
That regular, say 12-ounce full sugared Coke is probably all the sugar you need.
Almost for the day.
For the whole day there.
Yes, sir. Yes, sir. Especially if you get one of those Route 66s.
And I'm guessing you probably drink, the average that drinks Cokes like that, you say you drink 3 of those a day.
Oh.
And I'm probably lowballing for some folks. I bet there's people that pull down a 6-pack or a 12-pack a day.
You're correct.
Yeah, and if you just cut that out alone, you could probably eliminate some of your risk factors right there. If you're young and just trust me, I kind of wish now in my pushing 50, I wish I knew some of these lessons now and back those days. And we were just dumb kids, and we, hey, here's your sodas, here you drink. And now we're like, oh man, it's you got to really be proactive on looking at what goes in, and especially when you're at the grocery store. That is because, you go in these and you see all the labeling and the packaging and marketing, but when you start reading the actual nutritional list and some of the carb values on things, and you're like, man, 1 servings, and then you look, and the box rarely has 1 serving. It's got 4 servings, and you're like, oh, but it's like you realize you're looking at 1/4 of the numbers if you eat this whole box here, and that's I think people don't realize that's where I think a lot of us are making mistakes when it comes to diet choices and things like that.
Absolutely, and then let's also look at what were you told when you were a young person. Okay, I even caught myself saying this to my daughter: finish your plate. There's starving people in Africa.
Yeah.
I've caught myself saying that too.
Yeah.
So we're conditioned because I heard it over and over and over and over as a child. And when you have food that's good, it's just ingrained in your mind. I'm going to finish this.
Sure.
Right. And you don't need to. That's kind of what I'm trying to do.
Sure.
And trying to bring, this epidemic to, I'm not going to say a close because I don't think diabetes is ever going to go away.
Sure.
But at least improve the situation. We don't need to finish that plate, especially if you're going out to dinner.
Mm-hmm.
I recommend for my diabetics and borderline, there is an app you can get on your phone. It's called the Calorie King. And it has practically every restaurant here in town. You can pull it up and you type in Big Mac, right? And it'll tell you the amount of carbs. If I'm going on my memory here, but the last time I pulled that up, I think that a Big Mac alone was either 46 or 48 grams of carbs. Remember how I said that 45 to 50 gram level. So that's just something to keep in mind. Get that app if you've got a smartphone, because you can type in things. Okay, you go to a fancy restaurant and they're
There's
not
alternatives.
they're not gonna. It's not gonna have lasagna at, let's say, the Pasta Cafe, but you can type in lasagna and you can at least get a basic idea.
Yeah,
right?
they all the basic ingredients of lasagna are the same: the noodles, the sauce, the meat,
Yes,
the
sir.
cheese,
Yep.
and what other things, but ballpark it. And to be honest, the differences aren't going to affect that, because one chef may use one seasoning, or that kind of stuff's not going to mess with it too much. It's the the flour, the
Pasta.
wheat, the pasta.
Yeah.
That's what's going to kill you there.
And here in New Mexico, I'm half Italian. Okay. So where I grew up, the food that we ate in Chicago, which was where I grew up, was very pasta heavy, right?
Yeah.
Pasta's made up of flour and butter. Okay. Here in the Southwest, my 3 favorite types of foods are Asian food, Mexican food, and Italian food. All 3 really bad for you. I'm being honest.
Yeah, all loaded in carbs and but delicious.
Here, the tortillas, it's almost the same thing. You've got flour and lard instead of flour and butter. That's carbs and fat. Fat breaks down to carbs like that.
Sure.
And so you're just carbs upon carbs upon carbs upon carbs. That's how we have this epidemic getting worse and worse and worse with type 2 diabetes.
Gotcha. So, and that, again, it's really about paying attention to those things. Here's the good news, though. If you do, being diagnosed with diabetes today, it's not a death sentence. If you listen to
No.
your doctor and you start
No.
trying to work the program, you can live a long, normal life. Obviously, you got certain rules and things. You're not going to shut down the ice cream buffet or nothing. but
And the times are changing when it comes to diabetes. Back when I first was diagnosed, my doctors would tell me every single time I went in there, they point their finger at them, don't eat sugar, don't eat sugar, don't eat sugar. And I can remember this is long before I became a diabetic. I actually asked my doctor, and again, this is 40 years ago. I said, have you ever tried to go one day without eating sugar? I mean, seriously, one day without sugar? Sugar's in ketchup.
Mm-hmm.
Okay, sugar's in everything except maybe water.
Yeah.
And
you got to look at that. If it's some kind of flavored weird water, there's probably sugar in that too.
So now the focus has kind of changed. You got three things to do with diabetes. Number one, your diet. And we kind of already talked about that, 45 to 50 grams of carbs. Exercise, which is the key that I think a lot of my patients fall down on.
Well, that's your great cheat. Like,
yes.
And what I mean by that is you're burning the calories, you're doing things. So if you do mess up with the food, you're actually doing some benefit there and say, all right, well, at least now I can work it off a little bit, and that'll help help speed up the metabolism, which will process this stuff better and, in essence, make my sugars better.
You're absolutely correct. And the good news is, because it sounds like we're all talking doom and gloom today, but the good news is the medications nowadays, almost weekly, I find out about a new diabetes medication. And, when it comes to my philosophy, I try to hold off insulin to the very end, because giving somebody insulin, I'm on insulin, it can cause a lot of non-compliance. They forget to give their shot. They don't want to. It hurts. There's all kinds of reasons why they won't do that.
Sure.
So that's the last-ditch effort. And nowadays, with all the medications that are out there, we've got SGLT2s, GLP-1 agonists, all these different types of medications, and every day a new one coming out. The philosophy now has changed to kind of match your diet and activity level with your medications, exercise, and diet.
Gotcha.
And
to make it more patient friendly.
Absolutely.
Yeah. Something they can get behind.
You mentioned the ice cream bar. You're correct in that. They can't close out the ice cream bar, but you can still have ice cream within moderation.
Sure. Well, you got to balance life. I mean, it's like, great, I'm going to live to 90, but I'm sitting in a bubble eating rice cakes my whole life. Like, I'd rather knock 20 years off and enjoy it, and there's something to be said that. I kind of, my own self, I lean a little in that world here.
Yes, sir.
But we can't but we can certainly do both. I mean, we could say, you know what, all right, let's compromise here. Let's or at least start thinking about what you're putting in your body. Let's say, all right, you got two types of pizza here. This one's made with a cauliflower crust. This one's not. Let's give this one a try and see what you think. If you like it, maybe we can give this a try,
Or okay, maybe you hate the cauliflower pizza. Instead of eating the big thick crust, eat thin crust.
Sure.
So there's all kinds of, shortcuts we can get to with diabetes. And then let's say it's your birthday, right? There's a piece of cake sitting in front of you, right? You're okay to eat that, but remember that next meal, no carbs.
Yeah.
No carbs.
Sure. You don't after you're done that cake, don't go and have a big tuna sandwich with with 10 pounds of mayonnaise and bread,
And another way to actually help you keep your diabetes under control, they have this wonderful device now. It's called a continuous glucose monitor. I have one on my body right now. I change out the monitor every 10 days, and it can give you a continuous glucose reading. In fact, before I came in here, I hate to admit this, but I had a little bit of candy because my sugar was crashing. This is early for me. I usually start work at 8, and I didn't have time to eat breakfast this morning.
Well, I thank you for coming in.
Yeah, no problem. Morning. But, I checked it right before I left my house, and I saw that it was going down, and I didn't want to sound like, not intelligent when I came and talked to you this morning. So I had a couple of sugar. Stop. You're intelligent. I listen to you. I don't want to say every morning, but almost every morning.
Well,
so
thank you.
don't ever shortcut yourself. Trust me. I worked in radio 40 years ago. Wait a minute. I got to think about this.
We'll just go
30 years ago. 30 years ago. So yes, sir. So trust me, when it comes to doing what you did or do, it takes a lot of prep work. And if you're not doing prep work, you are going to sound, with your finger up your nose.
You're not wrong. Yeah.
So I you need to give yourself more credit. So that's bottom line.
Well, thank you. I'm a self-depreciating humor type guy anyway. I figure if I can make fun of myself, then that gives me license to make fun of other people.
Absolutely, absolutely.
But when we talk about this here, I mean, let's talk. Let's go back to warning signs here and begin. Like you said at the beginning here, if you're seeing someone that's frequently having to go pee, to go urinate,
that's the big one.
That's the big one.
I would probably say that's the number one most commonly seen sign.
Gotcha.
Is having to pee all the time, being thirsty all the time. Believe it or not, hunger can also be one.
Because your body's craving different things?
The glucose.
Okay.
Because believe it or not, you've got
the sugar's not getting where it's going to.
Yeah, you've got plenty of glucose in your blood.
So is it kind of like, if I'm getting real rudimentary, but kind of give people a grasp it. So basically all the sugar that's coming in is getting stored there, but the distribution system is messed up, so it's not getting it anywhere.
Exactly.
So you just keep piling more in, and here we go. It's depleting the places that need it, and where you don't, it's adding as fat and everything else, I'm guessing.
And you can also see, believe it or not, with diabetes, especially type 1, and I've seen it happen in type 2 too, you can be very large and all of a sudden you have a 30 or 40 pound weight loss, almost immediately.
Gotcha.
And what's occurring there, it's almost the same thing as the keto diet, okay? The keto diet works because people are burning proteins once you get to a certain point. First you're going to burn fats because that's what's available.
Sure.
But then you start burning proteins, which happens in diabetes too, because your cells need that glucose, as I was explaining, and it will do anything to get that. And it actually causes burning of your metabolism.
Okay.
It speeds that metabolism up. So you're always burning something. And with that, you start to lose weight, and considerable amount of weight at times, because it's all coming from your protein.
By the way, it's not a diet you recommend, but
I usually don't recommend the keto diet because there's some research that shows that it can create insulin resistance, which can lead to borderline diabetes. Insulin resistance is kind of almost the same process. When you'll lose 40 or 50 pounds, in a couple of months.
Sure.
But then when you start eating carbs again, guess what? You gain it all back plus some.
And that's my problem with like the diet, that diet mentality anyway. It's like, yeah, if you're losing to lose a bunch of weight, sure. I mean, I can see that as a option, but you've got to remember that at the end of the day, you can't go back to once you've hit your goal weight, you can't just say, all right, game on, back to eating again, because you're either going to gain it all back or gain more back. And so if you're going to make that decision, you got to make it a lifestyle decision, and you got to, and I think even folks with diabetes, when the doctor tells you you're pre-diabetic or you're diabetic, you're going to have to make some changes here. A lot of people are like, oh, great, I'm going to be eating kale the rest of my life. And you can't do that either, because you're not going to work if you just do that total, all right, if you dive in with both feet, I think you burn yourself out on that a little bit. So all in moderation, changes in moderation. When you're making a lifestyle change, little at a time, keep making progress forward, because if you try to bite off too much at one time, you're setting yourself up for getting overwhelmed and then just regressing.
Crash and burn.
Yeah, and I mean, and if I'm saying anything wrong here, please.
No. You're straight on the mark.
Just my own life experiences and stuff.
Straight on the mark. I can tell you one of my best controlled diabetics that I've ever seen, and I've been seeing this guy for close to 13 years. We were talking before about everything in moderation. You mentioned that as well too. Mm-hmm. And he lost a bunch of weight. He was a very large gentleman. Lost a bunch of weight, and then he more or less during the day had very well control. In the evening, he'd eat ice cream almost every single night. He was treating himself, but it wasn't 3 bowls of ice cream. Mm-hmm. It was a little bit.
Sure.
And with that, it kind of still gave him the satisfaction for his sweet tooth, but he was.
I'm doing my best, but I can still do what I want. Yeah.
And he was always, we have this indicator in hemoglobin A1C, which is a 3-month evaluator of how well you're doing with your diabetes, right? And there's this magic number, and this changes almost monthly with the American Diabetic Association. Anywhere between 6.5 to 7 is considered controlled, right? This guy is always in the low sixes, sometimes even in the fives.
Wow.
And he's still eating ice cream. So, he's using that same kind of concept, what I was talking about before, the 40 to 50 grams of carbs during the day, and actually even below that. And then at night, he has, I'll say, maybe 50 to 75 grams of carbs with the ice cream.
Okay.
And, that helps him stay happy.
Gotcha. I would guess too, and maybe, and I'm no expert on all this, but when you do it, when you go to bed, I mean, I imagine that has some variables in there too. What your body does at night when it's recharging, restoring, and things like that, and how it uses the sugar. I imagine that plays a role in that somewhere too. I'm guessing.
Absolutely. In fact, most diabetics, I'm not going to say 100%, because when I have a diabetic come in to see me, I try to get them to do our finger sticks, at different times. If you're a type 2 diabetic, Medicare, which most of my patients are on Medicare only allows you to check your sugar once a day, which is a travesty in my mind. But what I have my patients do to get around that is, we'll say on Monday, I have them check it first thing in the morning, right? And then on Tuesday, we check it right before lunch. And then on Wednesday, right before dinner, and we just repeat that, right? So once a day, but one day, first thing, next day, right before lunch, next day before dinner. Most diabetics have trends. And as I already said, most diabetics, it's really high in the morning, but I've gotten all different kinds. So then what I do to help with that is change the timing on the medication, which helps a lot of people. And a lot of my diabetics are on 2 or 3 or 4 medications. And so in the morning, we're taking the standard with metformin. At lunch, maybe we're taking the Giardians. Giardians is something that helps you expel sugar through urination.
Okay.
I mentioned earlier that most times we don't start smelling sugar until about 200.
It lowers that number.
Yeah, it lowers it to around 80 to 100.
Okay.
And also,
so it's like a flush system.
Yeah, almost. It opens up gates in your kidneys. It helps you to get that glucose out.
Gotcha.
And it does it in a good way, because let's say you don't know you have diabetes and you're spilling it in your urine at that point. That means your sugars are around 200. Glucose is a very complex molecule, and it can damage your kidney unless you're taking this medication I just said, because it's opening up the gates.
It's not letting it linger around in there.
Yeah, exactly.
Gotcha.
Exactly.
Interesting.
Yeah.
Of course, folks, if you're looking for a family practice doctor for a little time here, or maybe you're thinking, you know what? Maybe it's time for me to
get
start checked out here, and maybe I'm hearing some of this stuff and I'm peeing a lot more than I normally do. Maybe I do need to get this looked at.
Oh, the other thing to remember on that too, family history, especially with type 2 diabetes. If you've got somebody in your family that has diabetes, get yourself checked. It's really easy.
Well, it's
really easy.
It's like you said, more people are more susceptible than others here, and that DNA, obviously, that's the roadmap. That's, you look at your parents, you look at that's the roadmap of everything. And so odds are, if your parents and their DNA is having the problem, you're probably, it's no different than a lot of other things. When they talk about heart disease or breast cancer, any of these things, there's a lot of hereditary connections there on some of these. So,
yes, sir.
Yeah.
Absolutely.
So get it looked at here and make the decision. And I'm telling you, if you get that the call here, or get this says there's a whole world of options to you, and even and I'm sure when you sit down here with Dr. Jewell, he'll give you all those resources. But even outside of that, talk in the extension office. They have programs and things that diabetics cooking classes, so you can learn different recipes and things. So if you're like, man, I'm a pizza, is going to hurt me. All right, well, let's find different ways to enjoy that pizza.
You're right.
And things that you can do it more often, but with healthier ingredients and things like that. So, so schedule an appointment with Dr. Jewell's office. You can call 575-627-4200.
Yes, sir.
And I'm not sure if is that your office number?
Yes, sir. That's the office right here in Roswell. And that's
very good.
That's the best number to reach, because there's also another number that you can call, and that'll patch you down to Albuquerque.
Gotcha.
And then when that happens, let's say if you're a newly diagnosed diabetic, I want to spend a little bit more time with you, kind of tell you some of the things that we talked about here.
Gotcha.
You need to know that. You can't just go into this blind. And
well, you got to arm yourself with the information and the education with it, because you're entering a new phase in your life, and let's be honest, the more of your family that's involved with that, the easier it is, because diabetes really is a family cure. It's
Yes.
when one person's eating a diabetic's menu and the rest of the family isn't, that is not
Doesn't work.
That does not bode well for folks. So
No, it doesn't work.
awesome. But again, call Dr. Jewell's office 575-627-4200 and anything through Lovelace. If you got maybe if you need a specialist for something else too. I'm sure they can redirect you to wherever they need to go, or check out the Lovelace.com website, and you can find a doctor right through there and
Absolutely.
look up everything you need there, and including Dr. Jewell here. So
We're trying to expand too at Lovelace. So, call us. You never know who we're going to have popping up.
absolutely. Well, do we get everything we need, at least for now, or do you...
I think so. I mean, if you have any questions, ask me now, because
Sure.
honestly, I've been a diabetic for 42 years. I've walked a mile in these patients' shoes.
Yeah.
I've been there, done that. And,
And I imagine that your patients can appreciate that because, especially if we always have these images of doctors always talking down to you on things and stuff. That ideology is changing, obviously, but there's still people with that mindset. But when you got a doctor that's like, all right, well, I got to go take my readings. You want to take, you know what I mean?
Yeah.
You know what I mean? When someone's walking those steps with you, it kind of makes that path a little easier,
Well, I've always prided myself. My big thing when I see a new patient, or any patient actually, is communication.
Yeah.
If I don't listen to what my patients are saying, then I'm going to miss something. And that's one of my pet peeves when I see doctors and they do that, where they're just sitting at their computer and typing away and not
Sure.
paying attention to you. It's time to move on.
Well, you're a bit of a detective. I mean,
Yeah.
as a especially a family practice doctor, where
Yes.
people saying, I got a owie right here. Well, there's about a billion things that could be coming from.
Yep.
Let's ask some more questions here, and so that's part of the tool of being a doctor, is listening what the patient's saying. So
Absolutely.
So come, and if you got those issues, and then of course, if you just general health medicine, if you need physical, if you need, just general care, you come in and got a growth or something on the skin, something you want to look at, something you gotta, some stuff you see the doctor for.
Yes, sir.
Dr. Jewell can handle it for you.
I've seen a lot of things in my 13 years of doing this. A lot of things.
Yeah, you'd be surprised with everyone burning warts to everything in between.
Yes, sir.
So
Yes,
awesome.
sir.
Well, thank you, sir. Appreciate it. We'll let you get to the office, and
All right.
I'm sure you got a bunch of people ready and waiting to see you here.
Yes,
So,
sir.
Awesome.
And always, it's a pleasure talking with you.
As well, thanks for talking to us, and go get a real breakfast now.
Yeah, no more Skittles, right?
That's right. Thank you, doctor.
You're welcome.